Hello everyone, welcome to Anatomy Log. Human anatomy is the study of structure of human body. It remains an essential and important topic of the branch of science in medical research and surgery. So, we are the first year students of Pltci College of Medicine, and this is our anatomy lab. Myself, Mbbs, and my teammates are Adit, Jackson, Dilip, Agildasan, Ilakian, Venkarari, Shilpa, Rana, Divyadarshini, and Niranjana. Together, we are the second group of Section A. When you come over here, you can see the cadaver we will be dissecting on. Today, in our vlog, we are introducing you guys to the upper extremity of human body. My teammates will be explaining all the muscles here. First, Dr. Ilakian will be explaining the pectoralis major.
Hello one and all, I am Ilakian. I am here to explain the muscle pectoralis major. Pectoralis major has three broad origins: the clavicular part, the sternocostal part, and the abdominal part, and it has its insertion on the greater crest of the tubercle. And it is supplied by the anterior and posterior circumflex humeral vessels and the suprascapular and subscapular vessels. And it is supplied by nerves like axillary, muscocutaneous, and suprascapular nerves. Okay, let's go into the movements of the joints, the shoulder joints. The flexion is helped by pectoralis major, and it also helps in the adduction. Okay. And it also helps in the medial rotation of the shoulder joint. That's all, guys.
Hi guys, I'm Dr. Dilip. Now I'm going to explain about pectoralis minor. The pectoralis minor muscle is one of the superficial muscles on the anterior aspect of chest and is located deep to the pectoralis major. This is pectoralis major. As you can see, it is located deep to the pectoralis major. Pectoralis minor origins at 3rd, 4th and 5th costal cartilages, and it inserts at coracoid process and medial border of scapula. It is innervated with lateral and medial pectoral nerves, and it is also an anterior exoappendicular muscle along with pectoralis major, subclavius, and anterior serratus anterior. Together with these muscles, pectoralis minor provides stability to scapula and also provides various motions of the scapula. It is also used as an accessory muscle for respiration. It is supplemented with blood by thoracoacromial artery, superior and lateral thoracic artery. And that's it, friends, about pectoralis minor. Thank you. And the next muscle is going to be explained by my group mate Shilpa.
Hello all. So I'm Dr. Shilpa. So today I'm here to explain about deltoid muscle. So do you know where deltoid muscle is located? So it's located in this part. This is shoulder. So shoulder is shoulder muscle. So it's otherwise known as like deltoid muscle. So it's a skeletal muscle. So what is the function of this deltoid muscle? It's for the movement. So movement of the arm. It's like abduction. So abduction means away from the midline. Then flexion and extension. Flexion is like this and extension is like this. Moving forward is flexion and moving backward is extension. So all this movement, our deltoid muscle plays an important role. So where does this deltoid muscle name derive from? So it derived from a Greek word, which means, Greek word delta, and they shorten like delt. So the word deltoid muscle came from the triangular shape of delta, which is a Greek word. Now we are going to see, the functions, it's like actually what I told earlier is like the movement of the arm, and it also protect and protect the shoulder, this deltoid muscle. So now we will see like the origin, insertion, blood supply and nerve supply of deltoid muscle. And the joint which is present in the deltoid muscle is ball and socket joint. So now let's see where does the origin, blood supply, insertion and everything by looking at the muscle. So let's see. this is the deltoid muscle. From here to here, the rectangular portion you can see, this is the deltoid muscle. So this also protect and stabilize your shoulder point. That is stabilize in the sense it prevents the shoulder from dislocation. So now we will see the origin. So there is three origins, that is one like anterior. From this to this is the anterior deltoid or clavicular fibers. So this is otherwise like we can call it as like front delts. So this is the portion. So where does this arise from? This arises from the lateral 1/3 of the clavicle. So that is why it's otherwise known as clavicular fibers. Next is the lateral deltoid, that is intermediate or acromial fiber. This portion. From this to this portion of the deltoid muscle is the intermediate deltoid or acromial fiber, that is middle delt. This is the front delt, this is the middle delt. So where does this arise from? The surface of the acromion of the scapula. So from the back, from here it arises from the acromion. So other than the anterior deltoid and the lateral deltoid, we also have a posterior deltoid which is at the back. So the posterior deltoid is otherwise known as rear delta. This arises from the posterior border of the spine of the scapula, which is present in the back. So this is the whole deltoid, and deltoid is divided into three. That is the anterior part, that is anterior delts or the front delts. The middle delt, which is the lateral or acromial fiber. The back one is the posterior deltoid or spinal fibers. So we have seen the origin of the deltoid. Now, where does the blood supply comes to the deltoid? So it comes from the thoracoacromial artery, that is acromial and deltoid branches. So where does the blood supply of the delta comes from? By the thoracoacromial artery. Next, we are going to see the nerve supply. The nerve supply for the deltoid is from axillary nerve, C5 and C6. Insertion. After the origin, where does it insert? So insertion is to the deltoid tuberosity of the humerus. Now we are going to see the abnormalities affecting the deltoid, that is deltoid muscle tear. This happens because of the dislocation of the shoulder. So now from what I have told, we have seen the origin, insertion, blood supply, nerve supply of the deltoid and the function too. So next, my friend Adit will explain about the biceps brachii.
Hello everyone, I am Dr. Adit and today I am here to discuss the muscle biceps brachii. So everyone knows where the flexing biceps are. So this is the biceps brachii muscle. It is one of the chief muscles of the arm. It has two heads which merge into one distal body, the short head and the long head. The long head originates at the supraglenoid cavity and the short head originates at the coracoid process. Both the heads unite into one large muscle belly at the anterior side of the humerus and it attaches to the radial tuberosity. The muscle is innervated by the musculocutaneous nerve. The biceps is a two-joint muscle. That is, in shoulder joint, both the muscle head partially enforce opposite movements. That is, the long head, it pulls the arm away from the trunk, and the short head, it pulls the arm towards the trunk. It also helps in inward rotation and also supination. And when both the heads contract simultaneously, it leads to arm bend. So, apart from all these movement functions, it also helps to support the humeral head in the shoulder joint. So, that's all about the muscle biceps brachii.
I'm going to tell about the muscle brachialis. Brachialis is known for its powerful flexion of the forearm at the elbow. Since the muscle is superficially covered by the biceps brachii, it is often not regarded as the most powerful flexor of the forearm. It originates from the distal half of the humerus and in the anterior surface, and it is inserting into the tuberosity and the coronoid process of the ulna. Although the muscle participates in quick flexion, its isometric contraction maintains the muscle in flexible position, especially when weight is applied. This muscle is supplied by the musculocutaneous nerve of innervation C5 and C6. It is also supplied by the minor branch of the radial nerve of nerve root C7. The brachial artery supplies the brachialis muscle with blood. The damage to the musculocutaneous nerve proximal to the brachialis can lead to the damage of the biceps brachii and also brachialis, leading to the elbow flexion. The next muscle will be explained by Jackson.
Hello everyone, my name is Jackson and I am here to explain something about the unique muscle in the body. And the name of the unique muscle is brachioradial. So this is the muscle. I told it unique because it is the only muscle which connects bone to bone. If I talk about the position of the muscle, it is lateral to the cubital fossa. Cubital fossa is nothing but a triangular knots in this elbow joint. So this is located laterally to that and distal to the biceps muscle. So the origin of this muscle is it starts from lateral supracondylar ridge of the humerus and it inserts to the stylar process of the radial bone. The nerve supply passing through this is the radial nerve, as this muscle is present above the radius bone, and the blood supply is radial artery. And then actually this muscle helps in the support of the elbow joint. So this muscle helps in the extension and flexion of the elbow joint. Elbow joint is nothing but the joint made by the humerus bone with radius and ulnar bones. So the fracture or the strain caused by this is especially by the overuse of this muscle. Overuse in the sense lifting heavy weights, and especially in tennis players, they use this muscle a lot. And that condition is called tennis elbow. So that's all.
Hello everyone, I'm Aglarism. I'm going to explain about oblique muscle. This is the oblique muscle. Oblique muscle cover the side of the abdominal area, being large and sitting on the top surface of the abdomen, right below the subcutaneous fats and skin. The main function of the oblique muscle is it pulls the chest downwards and compress the abdominal cavity. Oblique muscles mainly contain the nerve, lower 6 thoracic spinal nerve from T7 to T12. That's it. Thank you.
Hello everyone. I am going to discuss about the rectus abdominis muscle. Rectus abdominal muscle is a vertically running muscle of the anterior abdominal muscle group. Let's see the rectus abdominis muscle. So this is the rectus abdominis. The origin of rectus abdominis it arises inferiorly by two tendons, lateral tendon and the medial tendon. Lateral tendon is attached to the pubic crest and medial tendon interlashes with the tendon opposite side arises from the pubic symphysis. Now the insertion of rectus abdominis. It is attached to the cartilages of 5th, 6th and 7th rib and to the xiphoid process. Innervations of the rectus abdominis is intercostal nerve and subcostal nerve. The intercostal nerve is T7 and T11, T7 to T11, and the subcostal nerve is T12. Rectus abdominis helps us to flexes the vertebral column of the trunk. That is the movement of vertebral column towards front or the movement of trunk towards front, and tenses the anterior thoracic wall and the depression of the hip. So these are the functions of rectus abdominis. Thank you.
Hi guys, I am Dr. Intadri. I am going to explain about the muscle pronator quadratus. The pronator quadratus is a square-shaped muscle, and the pronator quadratus is a small, thin, unsupinated muscle which is lying in the anterior compartment of the forearm. The pronator quadratus, the origin is in the distal anterior part of ulna, and insertion is the pronator quadratus is distal anterior surface of radius. And the nerve supply of the pronator quadratus is median nerve, and the blood supply of the pronator quadratus is interosseous artery. And the name only indicates the pronator quadratus is for the pronation of the forearm of the proximal radial ulnar joint, and the pronator quadratus is helpful in pronation of the forearm and the palm, which is helpful in writing and typing of the computer. And the next muscle will be explained by my friend Pltci.
Now I'm going to tell about the pronator teres muscle. As you can see here, this is the pronator teres muscle. It is a fusiform forearm muscle found in the superficial layer of the anterior compartment of the forearm. The origin of the pronator teres muscle will be at the humeral head, the medial supracondylar ridge of the humerus, and the insertion will be at the lateral surface of the radius. And the nerve innervations for this muscle will be median nerve, C6 and C7. The blood supply for this nerve will be through the branches of the brachial, radial and ulnar arteries. The primary function of this muscle is to pronate the forearm and to assist in the flexion of the forearm at the elbow joint. It has essential involvement in the sporting activities. Thank you for watching our video. See you soon in our next vlog. Bye bye.